Good day, everyone. My name is Professor Gideon Batuigas of School of Health Science Professions under the Nursing Department. I will be demonstrating with you today how to properly provide basic life support to patients. That includes proper chest compressions, proper way of giving breaths to patients, and proper usage of AED or Automated Electronic Defibrillator. The objective of this lecture demonstration is for us to know how to properly provide basic life supports to patients. Particularly, we will be using the standards of American Heart Association. Under AHA standards, there are 5 links of survival. First, immediate recognition of cardiac arrest and activation of the emergency response system, or EMS. Second, early cardiopulmonary resuscitation, or CPR. Third, rapid defibrillation. Fourth, effective advanced life support. And last, integrated post-cardiac arrest care. The materials that we will be using for this demonstration would be the adult CPR mannequin, the one-way valve attached mask. We will also be needing the bag valve mask, or ambu bag, and the AED, or Automated Electronic Defibrillator. At this moment, I will be demonstrating to you how to do proper compressions. But before that, let us review some critical concepts that is involved in CPR, or chest compressions. It is important that we start compressions within 10 seconds upon recognition of cardiac arrest. It is also important that we should push hard and fast, with a compression rate of at least 100 per minute, or at least a depth of 2 inches for adults, approximately 2 inches and 5 centimeters for children, and at least 1.5 inches or 4 centimeters for infants. In addition, we should also allow complete chest recoil and minimize interruptions. Interruptions is only allowable within 10 seconds. Avoid excessive ventilations in patients as well. Let us put it this way. Given a scenario, for example, we have a patient who is suddenly just walking in front of in any streets. And then while walking, the patient suddenly feels chest discomfort. And then the patient suddenly feels diaphoretic and is now going to faint. Upon fainting, the patient is now seen lying on the floor. Given, for instance, this dummy patient is lying on the floor. Here's how we should respond to that kind of patient. The scene is safe. Stand back, please. Stand back, please. I am a certified BLS provider. My name is Nico. Please give room for the patient. Please sir, are you okay? Please sir, are you alright? The patient is unconscious and is not responding. Check for the breathing status. The patient is not breathing. Activate EMS and get an AED. Check for the pulse. 1002, 1003, 1004, 1005, 1006. The patient has no pulse. Proceed with chest compression. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. At this point, I will be demonstrating with you how to utilize the AED, or Automated Electronic Defibrillator. AED is a device that is used to deliberately deliver shock to patients upon recognizing that the patient is in cardiac arrest. It is automated and it simply determines whether the patient needs shock or not. The usual standard AED comes with these electronic pads. These pads indicates where would you locate the pads depending on the specific locations of each pad. Now for this pad, you would locate this in the upper sternum, and the other would be here in the lower sternum, just below the breast. The first thing that you should do before you place or you do everything else is to turn on the AED.
Apply pads to patient's bare chest.
If you have noticed, it says apply pads to patient's bare chest. Again.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
After applying pads to patient's bare chest, we will plug in the connector to the AED machine or device. Now we plug it in.
Analyzing heart rhythm.
The AED instructs us to apply pads to patient's bare chest and then plug in the connector towards the AED machine. When doing so, the AED automatically analyzes for the heart rhythm. It will analyze for the heart rhythm whether or not it needs shock or it needs to deliver electronic shock to the patient's chest or heart rather.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now.
And it says deliver shock now or press the orange button now. It means that you need to deliver shock to the
Deliver shock
patient.
now. Press the orange button now.
So you may say, shocking in 3, 1, 2, 3, clear.
Shock delivered. Begin CPR.
Okay, that is the initial step or way in delivering or rather making use of AED in patients initially. The 2010 AHA guidelines for CPR recommend a change in the BLS sequence from steps ABC or airway, breathing, chest compressions to CAB, chest compressions, airway, breathing for adults, children, and infants. Again, let us emphasize that to provide high-quality CPR, it is necessary for us to remember to start compressions within 10 seconds of recognition of cardiac arrest. Push hard and fast, with a compression rate of at least 100 per minute with a depth of at least 2 inches. Let us allow complete chest recoil after each compression. Let us minimize interruptions by trying to limit interruptions up to less than 10 seconds only. Let us give effective breaths that make the chest rise and avoid excessive ventilation.